Thank you. It's a pleasure to be here. I have a question for you about your future. Where are you planning to die? Now, I don't normally start a conversation this way. And as a human, I'm not really interested in where that actual most personal of moments occurs. But as an architect and an urban designer, what I want you to think about is who will care for you in your final years? Will there be children or family nearby to hear your stories? How will you access a meaningful connection to your community or to the things that give you great joy? The principal position and the structural location of the community that you choose to age and die in will determine these answers. It is the locational choices that we make that primarily determine the quality of our ageing experience. Look at that tie. God, what was my mother thinking? This is my granddad. Born in 1899 in Hobart. At 16, he lied about his age and volunteered to fight for King and Country in the trenches in Belgium. After the war, he returned home, where he worked and lived in the city as a tram driver. He had the honour of driving the last Hobart tram on the day he retired in 1960, in an era where light rail was almost universally replaced across this country by diesel buses. Grandad lived and raised and worked and raised 5 children in a rich, mixed-use urban environment, less than 2 kilometres from the Hobart GPO, in that red dot there. I'm standing on a red dot. But in retirement, he lived with my Auntie Joan in an isolated public housing commission suburb on the outskirts of Hobart, in a tiny wooden caravan. He saw the atomisation of his city, and he saw the rise of car ownership that pushed the suburbs beyond the reach of his beloved trams. Grandad's wooden caravan allowed him to spend his final years around his beloved family. But I often wonder what he made of his isolated location, his suburban existence. No pub next door, no betting shop over the road, no post office down the street, no friends nearby, no convenient public transport. That was my past, but it will not be my future. I want to live in a mixed-use red dot, a vibrant urban community. So we need to change our thinking as individuals and as a community, and we need to reframe our ageing experience around neighbourhood and city and not be diverted by house. Sesame Street taught us that. I'm a child of the 70s, excuse me. So baby boomers started retiring in 2011, as we all know. No one else will age like them. And as demographers tell us, their cohort will move through our system like a pig in a python. Their ageing and other generational ageing will chew huge holes in future government budgets. The World Economic Forum tell us that the mismanagement of the ageing population is one of the top 5 global changes that are ahead of us. Global doom and gloom. It's very certain, in fact it's almost likely, and the impact is going to be high. But what do these changes mean for us on the ground? We know that increasing urbanisation is another driver of population ageing. And most of the large metropolitan cities with significant resources have plans to manage ageing, but none of them have any holistic plans that look at structural change at the neighbourhood level, at the ground level. It's even more difficult for regional communities, and I don't think that's Rob Nixon there. I think it's somebody else who's in denial about the where. But regional communities have less resources. Their populations are far more dispersed, and they suffer from lifestyle drivers like sea change, which concentrate their ageing population. And these lifestyle drivers also entrench this increased resistance to change. I moved here for these reasons. How dare they change? That should sound reasonably familiar to this community. And the other thing that happens is that there's this intergenerational war that goes on. So the young just leave. So ageing is compounding in our regional communities, and they're incredibly vulnerable. Change is needed, and I believe design is a provocative process that can start a useful conversation about the change we need in our regional communities. So 2 years ago, I had the pleasure of being involved in a collaborative research project with the University of the Sunshine Coast. Working with Dr. Claudia Balbin and PhD candidate Carolyn Osborne, we actually looked at the issue of infill seniors housing preferences in South East Queensland. We started from the proposition that we can't keep building new suburbs to solve our existing housing problems. We have to consolidate what we've got. And we used the World Health Organisation's Active Ageing Policy Framework, which quite simply says, if you want good outcomes for the health and well-being of seniors, you have to actually ask them, get them involved. It's not that hard. So we did. We took 2 groups of 22 seniors from Brisbane and the Sunshine Coast, and we asked them a whole lot of questions about their infill housing preferences. And we used collaborative design techniques. We gave them cameras and we told them to go out and photograph answers to their questions that we gave them about a series of questions around neighbourhood and housing. And they came back and they discussed those answers in groups and they prioritised their preferences and they represented them to each other. And the outcomes of that process were simple, but there were some powerful ideas. Our seniors told us that they preferred to have access to neighbourhoods with high quality open space, with public transport. They wanted neighbourhoods with access to young people because they understood it helped their health and well-being. They wanted walkable access to street-based shopping, not drive-to shopping centres. They wanted access to employment, to technology and education. So we took all of their preferences and we put them into a series of principles around neighbourhood and housing. And then we paired up the seniors with a group of architects and urban designers and we tested their preferences in their existing community. So we designed new housing in infill areas. And a series of typologies came out of that. But what was interesting was that the seniors understood that there were a whole range of complex competing factors that come into play when you're choosing the neighbourhood and the place that you live in. But what they told us is that they were prepared to trade those preferences in order to get access to the neighbourhoods that helped increase their ageing experience and make it more joyful for them. This is one of the typologies that we looked at, and it's called the garden house. This is one of 7, but it's a modular house, a 4-person bedroom with shared care possibly that might sit across 4 backyards in an existing suburb, freeing up these existing houses that they owned and the equity to pay for the care environment, but it means that family might come and live in here or they might be rented out to generate more income. So when we took the 7 typologies and we retrofitted them back into some middle inner urban environments in Brisbane, we found that we could locate them next to rail stations and a whole range of other services and amenities. And this allowed seniors access to a diverse range of housing depending on how they aged. And that was really valuable to them. We coined the term ageing in neighbourhood as distinct to ageing in place, which you may well have heard. And this concept acknowledges that significant change occurs throughout the ageing process, but that any corresponding stress that seniors feel throughout ageing can be minimised if a whole of neighbourhood approach is taken. So for us, nearness and neighbourhood outweighed shower hobs and handrails. And this research reflected other findings, other desktop research findings, which suggest that locality or an attachment to a familiar community becomes more important the older that you get. So I learned a few things from this process. One is that the neighbourhood preferences of the young and the old align. Of course they do, duh. One of the things about suburban thinking is that we have convinced ourselves that isolation and segregation is actually what we aspire to, rather than mixed use and diversity. So what I learned is that we can actually use the ageing boom to generate housing that will transform the lives of the young and the old and put them back together again, and we've forgotten how to do that. The second thing that I learnt was that if we don't use the money and the social opportunity that's created from an ageing boom to transform our regional communities, then that money is going to be wasted. And we need to do what previous mining booms have done in this country. Transform our communities. I want future generations to look at us and say, yeah, 200 years ago they had an ageing boom and they got it right. They created a whole series of fantastic places as a result. Well done us, The other thing that I learned is that these issues are very, very complex. And all of us, if left to our own devices, we will ignore the likely impacts that ageing are going to have on us. And we'll probably be overly optimistic about how ageing is really going to affect our lives. But if you use design and you engage with seniors, not only will they understand the issues and embrace them and come up with solutions for them, but they will then become incredibly powerful advocates for change at the grassroots, like Jim and Noreen here. These guys are amazing. These are some of our participants and they are unstoppable. They're causing all sorts of trouble in their local community and I love it. So we need to develop positive models for change at the regional level. But politicians can't do this. It's too difficult for them. They can't act without a flashpoint or a groundswell. So we need to develop these positive models for ageing for our regional communities at the ground level. We need to develop political power, and we need to push that up from the grassroots up to our leaders and get them to change what we want to change. Designers are the catalysts that can start this change. They can tell communities what this change means on the ground and what it looks like, and they can bring about the change if they dare to act and engage with the community. But it means they've got to get off their backsides, and they have to understand that design isn't there just to solve the problems of the young, the rich and the funky, okay? And fortunately, the GFC means that we've all got to develop new models of finding work. So architects can no longer sit in their offices and wait for clients to walk in the door. They have to get out and they have to start their own projects and they have to engage in what I call collaborative activism. So, ageing is change that will affect us all, undoubtedly, but it is change for good. We have to use design as a catalyst to make change within our regional communities and to transform them in a positive way. So my message to you is join me on the red dot. Plan to live in a vibrant, mixed-use urban community. Have a conversation with a designer about your future and what that will be. And then with others, identify your community and together act to transform it, especially if you live in a regional location. Thank you.